Blood was splattered everywhere. The monitors were beeping frantically. A panicked nurse was shouting in the hallway, "Cardiac arrest! Is there anyone here?" And there stood a woman, leaving her mop behind and taking off her gloves. The same woman a doctor had told 30 minutes earlier, "Clean up the blood. Mind your own business." But when she entered that room, no one knew she had been performing heart surgery for 15 years. Not yet. 18 hours earlier, Maya Reeves slipped through the back entrance of St. Catherine's Hospital. It was early morning, the sky not yet turning pink. She carried a plastic bag. Inside, a gray cleaning uniform, worn white sneakers, and a hair tie. She was 38 years old. Her dark brown hair usually fell in loose waves over her shoulders, but this morning she had pulled it into a tight bun. There was no makeup on her face. Her hands bore the marks of thousands of surgeries, barely visible scars on her slender, delicate fingers, slight calluses from long shifts. She changed in the locker room. She took off her designer jacket and put on a gray polyester shirt instead. She took off her Italian leather shoes and put on cheap sneakers. She hid the gold card in her pocket, the badge that read Dr. Maya Reeves, Cardiothoracic Surgery, Chief Surgeon, deep inside the locker. She looked in the mirror. The woman staring back at her seemed unfamiliar, but that was exactly what she wanted. The hospital board had come to her 3 days earlier. Chief Physician Dr. Gerald Hartman had stood in the conference room, speaking with a tense expression. "Maya, we have a problem. There's a growing hierarchy issue among the staff. Doctors are treating nurses badly. Nurses are treating support staff badly. Everyone is treating the cleaning crew as invisible. Patient satisfaction is falling. Morale is collapsing." Maya nodded. "I've seen this for years." "I know. That's why we're proposing an experiment. For one day, you will work as a cleaning staff member. No one will." Now, the experiment was beginning. When Maya stepped into the hallway, the morning shift had just started. Nurses were drinking coffee. Intern doctors were reviewing patient files. Jennifer Hayes was sitting at the reception desk, a 28-year-old nurse with a stern gaze, always eager to find fault with others. Maya pushed her mop and bucket cart past her. Jennifer looked up, scanned her with her eyes, and returned to her screen. Not a word. No greeting, no introduction. Just cold indifference. Maya moved toward the corner and began cleaning the floor. Her movements were slow and careful. She had learned how to be invisible. Hands busy, eyes down, ears open. "Is that the new cleaner?" A nurse whispered to her colleague. "I've never seen her before." "I don't know. Temporary, I guess. She won't last long anyway." Maya's lips tightened slightly, but her expression remained unchanged. Dr. Kevin Harrison was walking down the hallway. He was a 35-year-old, handsome, overly confident cardiologist. He was known as the rising star at the hospital, even though he took credit for most of the successful surgeries performed by Maya's team as if they were his own achievements. He almost bumped into Maya as he passed by her. The mop bucket swayed, spilling water onto the floor. "Hey," Kevin said sharply. "Watch where you're putting that thing." Maya looked up at him, her expression calm. "I'm sorry." Kevin frowned. "Sorry isn't good enough. These corridors are for patient traffic. The cleaning crew has specific times to pass through here. Didn't the boss teach you the rules?" Maya spoke in a low, flat voice. "He did. It won't happen again." Kevin rolled his eyes. "I hope so." Then he turned and walked away, speaking loudly to the intern doctor beside him. "These cleaners are really losing it. It's like the hospital is their private domain." The intern laughed, glanced sideways at Maya, and they continued on. Maya picked up her mop again. Her face showed nothing, but inside she was recording everything. Every word, every tone, every glance. Maya entered the cafeteria for her break. She got in line, took a tray, and silently chose her food. She had only an apple and water with her. She looked at the tables. The doctors were sitting in one section, white coats, confident conversations. The nurses in another, navy scrubs, coffee cups, tired laughter. The cleaning crew gathered in the far corner, quiet, among themselves. Maya joined them, An old man, Carlos, looked up and smiled. "You're new, aren't you?" Maya nodded. "First day. Welcome. I'm Carlos. This is Maria, this is James. It can be tough here, but you'll get used to it." Maya sat down. She watched the people around her. Carlos' hands were calloused. Maria looked tired. James was young, but his eyes had already lost hope. "How are people here?" Maya asked quietly. Maria shrugged. "Some are nice. Most don't see you. Some, well, they do more than ignore you." Just then, a laugh erupted from the nearby doctor's desk. Dr. Harrison was joking with a nurse, and his voice echoed through the cafeteria. Then his eyes drifted to Maya's table. His smile froze, as if even seeing them was uncomfortable. He turned his head and returned to his conversation. Maya quietly ate her apple. Maya was cleaning the corridors. She was pushing the heavy bucket cart, moving the mop in rhythmic motions. A nurse hurried past her, files in hand, cell phone to her ear. No, I told you, this patient needs to be discharged." "Yes, I know, but the beds are full. Just take care of it, okay?" She hung up the phone, took a deep breath, then looked at Maya. "Hey you, there's a patient in this corridor. Postpone the cleaning until the afternoon." Maya stopped. "I understand. Where do you want me to go?" The nurse pointed without thinking. "Go to the 4th floor, there are emergency rooms there. Clean them. Don't stand around here." Maya nodded. "Okay." She pushed the cart away. Behind her, the nurse answered another call, already forgetting Maya. The ER was bustling. Stretchers were moving back and forth. Nurses were shouting, patients were moaning. Maya stood quietly in the corner, waiting for a signal. A young doctor, Dr. Alicia Park, 29, smart but inexperienced, emerged from a patient room. She brushed past Maya while removing her gloves and bumped into her. The cleaning spray in Maya's hand fell to the floor. Dr. Park stopped, looked down, then looked at Maya. "I'm sorry," Park said sincerely. She bent down, picked up the spray, and handed it to Maya. "Things are crazy today." Maya took the spray, looking surprised. "It's okay. Thank you." Park smiled, tired but genuine. "First time I've seen you. Are you new?" "Yes, I started today." "Welcome. It can be chaotic around here, but there are good people." A page was heard and Park's pager beeped. I have to go. Take care." "Okay?" He ran off. Maya watched him go. It was the first time someone had treated her like a human being. It was the first time someone had said, "Thank you." Maya made a mental note of this. Maya entered the doctor's lounge to empty the trash. The room looked empty, but there were sounds coming from behind the door. Laughter, conversation. When she entered, 3 doctors were sitting on the couch. Dr. Harrison, Dr. Marcus Chun, orthopedics, and Dr. Lisa Brennan, neurology. They were drinking coffee, looking at their smartphones. Maya approached the trash can. They continued talking as if she weren't there. "The new protocol is complete nonsense," said Harrison. "As if we could shorten our surgery times." Chun shook his head. "Management doesn't understand reality. We're not robots." Lisa laughed. "Maybe they should get a robot cleaner. At least they wouldn't complain." They all laughed. Maya changed the trash bag, working silently. Hands busy, ears open. Harrison stood up, finished his coffee, and left the cup on the table next to Maya's, a few inches from the trash can. "Clean this up," he said, looking away. "No, please, no thank you. Just an order." Maya looked at the cup, then at Harrison. But the doctor was already walking away, his phone ringing. Maya picked up the cup and threw it in the trash bag. Maya was cleaning room 217. Inside, an elderly woman, Mrs. Dolores, was sitting on the bed. She was in her 70s, frail, but her eyes were sharp and kind. Maya worked quietly, careful not to disturb the woman. "Hello, dear," Dolores said softly. Maya looked up. "Hello. If I'm disturbing you, just say so, and I'll come back later." No, I'm fine. This is my home now anyway." Dolores smiled, sadly but warmly. "You look new. It's my first day. First days are hard. But you look good." You have a kind face. Maya paused, looked at the woman. Thank you. How are you? Dolores shrugged. I'm old. My heart is tired. But the doctors are doing what they can. I hope. Maya's heart tightened. She knew this woman's file, mitral valve insufficiency, surgery recommended but the patient hesitant. I'm sure they're taking great care of you, Maya said softly. I hope so. Sometimes it's very lonely here. Dolores looked out the window. People are busy. I understand. But sometimes, I just want someone to really listen. Maya put down the cleaning cart and moved closer to the woman. I'm listening. And she really listened. For 15 minutes, Dolores talked about her granddaughter, her husband, the old days. Maya sat, nodded, genuinely interested. The door opened. A nurse looked in. Jennifer. What are you doing? Jennifer said sharply. Is the cleaning done? Maya stood up. Almost. Then finish it and get out. Don't bother the patients. That's not your job. Maya bowed her head. I understand. Jennifer left. Dolores touched Maya's hand. You're a good person. Don't forget that. Maya smiled, small, genuine. So are you. Maya was cleaning the corridors near the operating room. This place was like her home. She had spent thousands of hours behind these doors, saving hearts, changing lives. Now she was mopping the floor. One of the operating room doors opened. A nurse walked out, removing her gloves as she walked. She saw Maya and stopped. What are you doing here? Said the nurse. Kimberly, experienced but intolerant. Cleaning, said Maya. Cleaning in the operating room section is only done by the special team. Who sent you? My supervisor said. I don't care what he said. This is a sterile area. Get out. Maya gathered her things. I'm sorry. Kimberly crossed her arms. Tell the cleaning crew to learn the rules. This isn't a playground. Maya nodded and walked away quietly. Behind her, Kimberly spoke to another nurse. These new cleaners don't know anything. Maya came back to the cafeteria. This time Carlos wasn't there, only Maria. She sat down next to her. How's it going? Maria asked. Maya shrugged. I'm learning. Maria laughed bitterly. Yeah, you learn fast. Who yells at you? Who ignores you? Who's nice? How long have you been coming here? 12 years. For my son. He's finishing high school. Then maybe I'll find something else. Maya nodded. 12 years. This woman had worked here invisibly for 12 years. Did you ever? Maya paused. Did you ever wish things would change? The way people treated you. Maria looked at her, her eyes tired but wise. Every day. But it doesn't change. Because to them, we're not people. We're just background. Your backdrop. And if you're invisible, no one notices they're being mean to you. Maya sighed. Maya was finishing the corridors on the 4th floor. Her body was tired, pushing the mop, carrying the bucket, bending and standing. It was a different kind of tiredness than surgical procedures, but it was real. As she turned the corner, she overheard a conversation. Dr. Harrison and Dr. Chun were standing inside a glass room, their voices echoing in the emptiness. Reeves isn't in the OR today, Chun said. I wonder where he is? Harrison shrugged. I don't know. Maybe a conference. Maybe vacation. Doesn't matter. The team can handle it. Your team? Chun asked in a joking tone. Harrison grinned. Well, I'm the head of cardiology. Technically, they're all my team. They laughed. Maya stopped, holding her breath. Reeves is good, but he's overrated, Harrison continued. I plan most of the surgeries. He just follows along. Chun raised an eyebrow. Really? I heard he performed the surgery that saved your life. Harrison waved it off. True, but who gets the credit? Me. Because I manage the relationships. Patients want to talk to doctors, not surgeons. Maya's jaw tightened. Her fingers gripped the broom handle. Inside, Harrison continued. Frankly, Reeves brags too much. If he ever leaves, I could easily. A page call interrupted him. Both doctors' pagers beeped simultaneously. Their faces changed. Emergency room. Cardiac arrest. They started running. Maya watched them go. Then she looked at her own pager, hidden in her locker, charging. But she didn't know this cardiac arrest would be special. Because the patient was Mrs. Dolores. And Dr. Harrison wouldn't make it. Maya was cleaning the hallway when it happened. A nurse ran in, shouting, "Code Blue! Room 3. Cardiac arrest." The alarm sounded. People rushed in from all directions. Maya's heart raced. She dropped her mop and took a few steps toward the room. She peered inside. Dolores was lying on the bed, her body motionless, the monitors showing a flat line. Dr. Harrison was inside, performing chest compressions. Dr. Park was preparing the defibrillator. Nurses were drawing up medications. "Give epinephrine," Harrison shouted. "Now. Administering. Charge. 200 joules. Charging. Clear." Shock. Dolores' body twitched. The monitor, still flat line. Again. 300. Shock. Nothing. Maya stood by the door, her heart pounding. She saw it, Harrison's mistakes, the wrong spot for compressions, the wrong angle of the defibrillator pads, the delay in timing. "Resume compressions," Harrison yelled, sweating. But the compressions were weak. He was tired. Dr. Park looked at him. "Dr. Harrison, should I take over?" "No, I'll handle it." But he wasn't handling it. Maya's hands trembled. She wanted to go in. But she couldn't. Not yet. She couldn't break character. But then she saw Dolores' face. That gentle woman, the woman who wanted to rest, and she knew. Roll be damned. She took off her gloves. She stepped forward. Nurse Jennifer saw her. "What are you doing? Get out." Maya didn't even look at her. She entered the room. "Hey!" Jennifer shouted. "Security." But Maya was already next to Harrison. "Stop," she said calmly. Harrison turned his head, shocked and angry. "Who are you? Get out." Maya looked straight at him. "Your compressions are wrong. You're doing them 2 centimeters to the right of the sternum. The heartbeat isn't coming back because you're not compressing the aorta." The room froze. Harrison's mouth hung open. You're a cleaner. What are you?" Maya stepped in front of him. She placed her hands on Dolores' chest. Correct position, correct angle, correct depth. 30 compressions. Now. And she began. The motion was flawless, rhythmic, powerful, professional. The nurses watched, frozen. Dr. Park started ambobagging, keeping the airway open. Maya continued the compressions. "Is epinephrine being administered?" Park nodded. "Yes." "How long ago?" 90 seconds. "Administer it again. Now." The nurse hesitated, looked at Harrison. Harrison was still in shock. Maya stopped, looked at the nurse. "Now." The nurse automatically administered the injection. Maya continued, counting 27, 28, 29, 30. Clear. Park delivered the shock. The monitor, still flat. Maya started again. "Change the pads. The angle is wrong." Park adjusted the pads. Again. 300. Now. Shock. And this time, a beep. Then another. The monitor moved. Weak, but there a heartbeat. "There's a pulse," a nurse shouted. Maya slowed the compressions, waited. Another beep. Stronger. "Returning to sinus rhythm," Park said, his voice trembling. Maya finally stopped. Hands lifted from the chest. Dolores' chest was rising and falling on its own. The room was silent. Maya stepped back, breathing, her hands damp with sweat. Everyone was looking at her. Harrison stammered. "You? How? You?" The door opened. Chief of Staff Dr. Hartman entered, followed by 2 security guards. "Ms. Reeves," Hartman said calmly, "I think it's time you introduced yourself." The room was very quiet. Dr. Harrison looked back, trying to make eye contact. "Reeves? What do you mean?" Dr. Hartman stepped forward. "Everyone, let me introduce you. Dr. Maya Reeves, head of the Cardiothoracic Surgery Department. 15 years of experience. Over 3,000 successful surgeries. And today, working alongside you, a cleaning lady. Nurse Jennifer gasped. Her face turned pale. Dr. Park's eyes widened. Dr. Chun entered from behind, stopped, and saw the scene. What? Maya removed her gloves. She raised her head. Her tone now carried authority. Rank. For the past 9 hours, I've been working as a cleaning lady in this hospital. As an experiment. At the request of the hospital administration. We recorded everything. A camera on the wall flashed. No one had noticed. How you behaved today was noted. Jennifer's voice trembled. I didn't know. Maya looked at her. You didn't have to know. That's the point. It was never acceptable to treat a cleaning staff member badly. But you did. All of you. Harrison exploded in anger. This isn't fair. You set us up. No, Maya said coldly. I gave you the chance to be your true selves. And you showed yourselves. Hartman interjected. This experiment was voluntary. Dr. Reeves agreed. Now we'll evaluate the results. Harrison's face turned bright red. Maya clasped her hands and looked at everyone in the room. I learned many things today, but the most important thing is this. A person's worth is not determined by their uniform. She turned to look at Dolores, who was now still breathing. This woman spoke to me this afternoon. She told me about her granddaughter. She said she was lonely. And you know what she said? Sometimes I just want someone to really listen. One of the nurses in the room bowed her head. But no one listened, because everyone was too busy, too important. Did you have time for a cleaning lady? No. But for a patient? Apparently not either. Dr. Park stepped forward, his voice broken. Dr. Reeves, I'm sorry. If I had known who you were. Maya shook her head. That's the problem. If I had known. Why should your kindness depend on my identity? Why should respect depend on rank? Park opened his mouth, then closed it. He had no answer. Maya scanned the room. Everyone here today made a choice. Some of you chose kindness. Some of you chose indifference. And some of you actively chose to mistreat the group. Jennifer swallowed. Dr. Reeves, I'm sorry. I didn't know. You didn't know because you didn't ask. You didn't even ask my name. You just saw a cleaner and decided I was worthless. Jennifer's eyes filled with tears. 30 minutes later, the hospital board held an emergency meeting. All department heads, senior nurses, and relevant staff gathered. A giant screen was mounted on the wall. Dr. Hartman stood at the podium. Today we conducted a social experiment, he began. Dr. Maya Reeves volunteered to work as a cleaning lady for 1 day. 17 cameras recorded all interactions. Now we will review the results. The screen lit up. First clip. Dr. Harrison bumps into Maya, yells, "Watch where you put that thing." The room grew uneasy. Second clip. Nurse Jennifer treats Maya coldly. "Are you done cleaning? Then finish up and get out. Don't bother the patients." Jennifer cringed in her chair. Third clip. The doctor is in the break room. Dr. Harrison puts his cup on the table. "Clean this up." "No, please. No, thank you." Harrison's face turned to stone. Fourth clip. Dr. Harrison and Dr. Chun are talking in the glass room. "Reeves is good, but he's overrated. I plan most of the surgeries. He's just following along." Murmurs started in the room. People looked at Harrison. Fifth clip. Nurse Kimberly kicks Maya out of the operating room hallway. "This isn't a playground." Hartman paused the video. Today, 47 interactions were recorded. 39 were negative or indifferent. 5 were neutral, and only 3 were positive. A slide changed. Names appeared on the screen. Hartman spoke. "These results are unacceptable. This hospital was built on respect, compassion, and excellence. What we saw today is the complete opposite of those values." Harrison jumped to his feet. "This isn't fair. You set us up. Legally." "Legally," Hartman cut him off. "Everyone was informed about an ongoing safety and quality assessment. You signed. Furthermore, Maryland is a unilateral consent state. The recording was entirely legal." Harrison's mouth shut. Hartman continued. But this isn't just a matter of conduct. Dr. Harrison, your situation is particularly serious. The screen changed again. Harrison's voice clips played. Reeves is good but overrated. I plan most of the surgeries. These statements, Hartman said, are not only false, they actively disparage a colleague. You are taking credit for clinical success. This is a breach of academic integrity. Harrison stammered. I was joking. It wasn't meant to be taken seriously. Maya stood up. Her voice was calm but sharp. Joking? Last month, I performed Senator Williams' emergency coronary bypass. You spoke to the media and said, our team. 2 months ago, the 14-year-old heart transplant. I did it. You took the credit. Since when is stealing other people's work considered a joke? The room erupted. Murmurs, shaking heads, shocked expressions. Harrison slumped into his chair. Hartman ended the meeting. This hospital now has a zero-tolerance policy. Regardless of position, rank, or department, everyone deserves the same respect. Is that clear? The room nodded silently. Good morning. People dispersed. Some in shame, some in shock, some in relief. Maya returned to her office, her real office. Large, glass-walled with a city view. Her desk was piled high with files. Her wall covered with diplomas and awards. She took off her uniform, showered, put on a suit. She let her hair down, waves cascading over her shoulders. She looked in the mirror. This was her, the real her. But she wouldn't forget the other woman, the one in the gray uniform, the quiet, invisible one. There was a knock. Dr. Park stood at the door, looking shy. Dr. Reeves? Am I disturbing you? Maya smiled. No. Come in, Alicia. Park entered, twisting her hands. I just wanted to apologize for not recognizing you today. Maya shook her head. Stop. You don't need to apologize. You did the right thing today. You showed kindness to a stranger, without regard for who she was. But everyone made a choice. You chose the right thing. That's why you got the award. Park wiped her eyes. Thank you. Seriously. That means a lot. Maya leaned forward. Alicia, I'll tell you something. You're one of the most promising young doctors I've seen in this hospital. Not just because you're smart, because you care. You genuinely value people. Don't lose that, ever. Park nodded, tears streaming down her cheek. I won't. They talked for a few minutes about mentorship, career, life. Park looked lighter as she left, as if a weight had been lifted from her shoulders. Maya went to the cafeteria. It was late now and most of the staff had left. But the cleaning crew was still there, finishing their shift. Carlos and Maria were sitting in the corner. Maya walked over to them. When they saw her, they jumped up. Dr. Reeves, said Carlos. We. Maya raised her hand. Please, sit down. They sat down. Maya sat down next to them. I wanted to thank you, Maya said. Today you two showed me true kindness. Without knowing anything. Without expecting anything. You were just good people. Maria cried. We just acted normally. Yes, Maya said softly. But most people don't. That's what makes you special. Carlos shook his head in surprise. The reward, it's really not necessary. Yes, it is. You keep this hospital running. Every day, unseen, you do your work. And no one thanks you. That will change. Maya leaned in. Starting tomorrow, every department in this hospital will hold monthly meetings. All staff included. Doctors, nurses, cleaning, food service. Everyone. Everyone will have a voice. Everyone will be heard. Maria wiped her tears. Really? Really? And more. Staff satisfaction surveys. Fair wage reviews. Training programs. This hospital will respect everyone. Carlos placed his hand on Maya's. You're a good person. Maya smiled. So are you.